Welcome to this episode of Lifestyle Matters. Today, I'm joined by Dr. Barton Jennings, a respiratory physician from Melbourne. Welcome, Barton. Thanks for joining us on this show.
No worries, Savita. Thank you for having me.
Great. So, Barton, I came across you when you did some webinars online for doctors, really, about lifestyle factors and low carb diets and things like that in terms of your realm of respiratory medicine. And I thought that was quite interesting because it's not often we find lots of specialists interested in lifestyle medicine. So I thought maybe we might just start with could you tell us what sparked your interest and how you came about this journey of sort of focusing more on lifestyle factors as part of your practice?
Sure. So it was actually in January of 2018, actually. I remember it quite clearly because my wife and I were going to this local gym, and the gym was run by a dietitian and a fitness trainer. And the dietitian practiced low-carb nutrition, and she was running this 6-week low-carb program. And my wife encouraged me to do it, just as out of an interest and for health. And I told her that no, I wasn't interested because I don't believe in it. It wasn't what I was taught at uni and went against everything pretty much that we had tried to do. But interestingly, in probably the 10 years before that, I'd been trying to lose weight, and I was exercising heaps, eating what I thought was the right thing to do. But my BMI always sat around 27, which is a bit overweight. And it got to the point where I thought, actually, this is probably just normal for me. So I just wasn't too concerned about it. Anyway, so we joined this low-carb program, and in 6 weeks, I lost 6 kilograms, and the next 6 weeks, lost another 4, and so I got down to about 80, and I've stayed there ever since. And so I thought, this is quite unbelievable what's just happening with this change from a nutrition point of view. I hadn't changed anything else. And so that really just sparked my interest. I thought, well, there has to be something in this. Why haven't I been taught this at uni? And so that's just really spurred me on to read more about it, to learn more about it. And the more I learn about it, the more interested I get, I guess. And that sort of also leads on to other areas of lifestyle, not just nutrition. And now I have, really enjoy using that within my clinical practice because, it plays a big role in respiratory and sleep medicine.
It's got a personal touch, I guess.
Yeah.
Did you, just out of curiosity, were you you said you were struggling to lose weight, were you doing exercise at that point, and had the exercise changed when you started doing your low carb diet? Was there much of a change?
No, I didn't change my exercise at all. So I was going, to the gym, doing sort of high intensity exercise 3 or 4 times a week, going for a few runs, and so quite a lot of exercise. But no, that didn't change at all.
Yeah. And that's the thing, isn't it? It's like, they talk about weight loss. 80% is actually nutrition, and the other 20% is your exercise. So that's just, case in point, really. And that's great. So I guess sorry?
I think that's very true. I say to patients who want to lose weight, you can exercise as much as you like. Exercise is very good for you, has lots of health benefits. I always, promote and recommend that people should be keeping active and exercise, but it's actually not the thing that's going to achieve weight loss. That's what you eat.
Yeah, exactly. So I guess since you touched on exercise, let's talk about exercise. How, given your background as a respiratory physician, what sort of advice would you give your patients in terms of when it comes to exercise and what the benefits are in respiratory function?
Well, I think everybody will benefit from exercise. I think it's obviously very important for overall health. And it doesn't matter whether you're a young, perfectly well person with no respiratory disease or someone who's really quite old with quite severe respiratory disease. Everybody will benefit from exercise. And so if we consider those patients with respiratory disease, one of the main problems is breathlessness. And although exercise in itself is not necessarily going to improve lung function, it does improve breathlessness because it improves fitness, improves cardiovascular fitness, improves muscle strength, and improves endurance. And so it improves your ability to exercise. And shortness of breath is very limiting and affects people's life so much. And sometimes if there's lung disease, there's only so much that can be done to improve the lung function from a lung disease point of view. And once we've maximised those treatments, then patients are often left still breathless. And so that's where exercise and conditioning is really important.
It was just not just one type of exercise, is it? It's a mixture of cardio and aerobic exercise, and also stretching and relaxation, practicing deep breathing and things like that too, is part of exercise, isn't it?
Yeah, no, certainly. I think different people would benefit from different types of exercise. I always like to think that probably the best exercise for most people is doing something that they enjoy doing, because if they enjoy doing it, they're more likely to do it.
Mm.
Sometimes in people who are especially a bit more elderly and might have underlying lung disease, doing that within a program is often very beneficial. So pulmonary rehab, so they can have supervision for their exercise, which gives them confidence that they might not have if they were just exercise on their own. And breathing exercises are really important, actually. It's a area of interest of mine too, because I think that sometimes people who get breathless, it may be to do with their pattern of breathing, sometimes as well as, or instead of, their actually underlying lung function.
Yeah.
And when people get breathless, they tend to pull air in from the top of their chest, and their pattern of breathing changes, and it can cause breathlessness. And certainly,
Yeah.
breathing exercises, as you say, can improve that.
Yeah. And I guess just going hand in hand with that, which ties into the other lifestyle factor that I often talk about with, lung diseases, anxiety, and
Mm,
breathlessness, and the subjective feeling of breathlessness. Many are, they might be mildly breathless from their lung disease, but they're anxious
yeah,
about getting breathless. And that just is
yeah,
like a vicious cycle that
it
goes
is
hand in hand.
exactly.
So,
It is exactly.
stress management is the other thing, which comes down to the whole lifestyle thing too. Stress
Yeah,
management and practicing deep breathing is
yeah.
also
And I
another
think
aspect
that
of it.
practicing deep breathing exercises like that is actually good mindfulness too. And practicing mindfulness is very good for anxiety. And just getting people to do diaphragmatic breathing exercises not only improves their pattern of breathing, reduces the anxiety as well, and so can sort of undo that vicious cycle of anxiety causing more abnormal pattern of breathing, which causes more breathlessness, that causes more anxiety. And if we can undo that vicious cycle, then people feel much better.
I know sometimes, we talk about mindfulness breathing. Do you have any sort of guides as to where or ideas where we could point people towards to in terms of mindfulness breathing?
I use a handout that I just use from, I think it's Cleveland University handout. It's really useful. It just is a very simple way to demonstrate to patients how to do diaphragmatic breathing.
Mm.
I also work with a respiratory physiotherapist, and we did a video on about this on YouTube as well as a part of our patient education talks about breathing. And our physio Ali was fantastic in taking all of the patients through on the video through different breathing exercises, um, which I think that they really benefited from.
Yeah, that's great. And the
Mm.
other resource that I use sometimes are exercise physiologists, the ones that who are really good with it. They're quite good in terms of guiding patients through it, especially those with, quite moderate to severe emphysema or COPD.
Mm.
I find that they're really helpful. It gives them a lot of guidance and confidence in doing exercise because many I find are like, I'm too breathless, I can't do
Mm.
exercise. What do you mean do
Yeah,
exercise?
yeah,
And referring them to these people who actually specialize in these areas, I find them really
yeah.
helpful.
Yeah, I do too.
Yeah.
I actually use exercise physiologists quite a bit for exactly that
Mm.
reason. And I think that's another vicious cycle of people who are breathless tend to do less exercise, so they tend to avoid doing things that make them breathless, and then they become more and more inactive, and that's a vicious cycle. And exercise physiology or exercising with supervision can be really helpful to try and break that as well.
Yeah, yeah. So moving on to the next point where you said they become more breathless and they become, they're more worried about exercising and they become
Mm,
more inactive. And that leads to obviously sedentary lifestyle and weight gain
mm,
potentially.
mm.
So, well, let's talk about weight gain and weight, the impact of weight on respiration. Um, what
Yeah.
what is your what pearls of wisdom around that?
So, as I was saying before, there are some people who are breathless, and whether they have underlying lung or heart disease, sometimes there's nothing more that can be done to improve their lung or heart function, but they still remain breathless. And so, then if they're overweight, then weight loss is always going to be able to help their breathlessness. So, and often patients, their weight does contribute to their breathlessness. So weight loss is always very, very beneficial, and that's obviously where improvements in nutrition can really help with weight loss. And people only have to lose sometimes a little bit of weight. It can be quite effective in improving exercise tolerance.
It's one of those things that I when I refer to a respiratory physician, my patients who have chronic lung disease, with their breathlessness, that I am, at wit's end, not sure how to manage this anymore. And half the time they come back saying, well, they just need to lose weight, because it's just the fact that that obesity is just actually causing the breathlessness, and there's nothing we can do in terms of medications, because we've maximized therapy, we've maximized everything else, and it's about weight loss. And if you think about it, if you have a huge gut, it's pushing on your diaphragm, and that just reduces your lung volume, and then reduces your ventilation, and then you become more breathless. So it's it's all just
certainly once obesity gets to that point, it certainly does put that external pressure on the lung as well, as you say. And I think one of the problems is that often, like, people will say, weight loss is beneficial, and that's fantastic, and that's really wonderful. But we actually have to educate patients about how to lose weight, because I don't think a lot of them know. And there's so much misinformation out there about diet and nutrition. And when people say they have cereal for breakfast and fruit, and they think that they're doing the right thing and can't see why they're losing weight, and you tell them that you should probably have bacon and eggs for breakfast, and just not on toast, they can't believe it. Like, they're really shocked, because it goes against what we've been told for so long. But if they do it, they actually do lose weight. So I think educating people, or telling them that they should lose weight, is okay, is sometimes correct, but we really need to help people know how to do it.
Yeah. When you think about it, cereal and things, the amount of sugar content that's in there, it sounds like a healthy thing. I guess, it's like, it goes back to the ads from many years ago, Kellogg's cornflakes. It's like your healthy breakfast. When you should look at it, the amount of sugar that's actually in the package, it's pretty impressive. I'd be choosing, rolled oats, for example, or, steel cut oats, one of those high fiber diets also, potentially. I mean, everyone's got different ideas in terms of what diet suits, but I guess, I think we're on the same page, where we're saying the carbs and the simple carbs,
avoidance of sugar and avoidance of processed foods.
Yeah, pretty much. I think that's the same tune that everyone sings out in the end.
I was just going to say, breakfast is the most important meal of the day, is just a saying that Kellogg's came up with to sell more breakfast cereal. Breakfast is not the most important meal of the day. As a matter of fact, if you wake up in the morning and you're not hungry, you're probably better off not eating breakfast. I mean, I never have breakfast when I feel hungry in the morning. So, I mean, prolonging that fast is actually quite healthy.
Yeah, no. Well, for myself, I have to say, like, when I did intermittent fasting, like, well, I had to stop because I was losing a bit too much of weight. But, intermittent fasting actually made me function better. Like, I had a clearer mind. So I do it a few days a week, just because of the functionality, how I feel doing it. And it's amazing how productive you become at the end of the, during the day. You don't need that sugar content, that sugar load first thing in the morning necessarily.
No. Well, you never need it, but.
So, do you have any other advice in terms of nutrition? So obviously you have a big interest in low carb, high fat diet. What sort of advice do you talk to your patients about this?
Firstly, I think it's important to explain why it is that is the best way for us to eat. And because I think people sometimes don't quite understand that, because we've always been told that if you eat fat, you will get fat. But in actual fact, the problem with the inability to lose weight is that if there is insulin circulating in our body, insulin causes fat storage. And in the presence of insulin, we're not going to be able to lose weight. And insulin is secreted in response to glucose or sugar. But not just sugar like in table sugar or in cereal, but also in bread, rice, potatoes. These are just glucose molecules stuck together. So once we eat these things, those glucose molecules come apart and they're just glucose. And they go into the blood. And we know that we need to keep our blood glucose very stable, because if our blood glucose goes up, then that's when we are diabetic. So insulin is used to maintain our blood glucose. But the more carbohydrate that we put in, the more glucose we put into our body, the more insulin we need to secrete to maintain that even blood glucose. So about 10 years before our sugar starts to go up and we're recognised to be diabetic, our insulin levels have been rising. And so what we really need to do is, if we stop putting the glucose in, or stop putting the carbohydrates into our body, then our insulin levels will come down. And as our insulin levels come down, that will allow our body to use fat for energy, and it'll start burning the fat. And so we actually have to stop putting the carbohydrates in to be able to burn the fat.
So you're basically sort of producing a state of ketosis, essentially.
Yeah.
And the other thing when I did my reading on that, there was another thing. I mean, correct me if I'm wrong, but what I also read was that carbs compared to fat produce a lot more carbon dioxide compared to, with the amount of oxygen being used, carbon dioxide is produced more when you're trying to metabolize carbs compared to fat.
Mm.
Now, when you put that into context with someone with chronic lung disease who've got like high levels of CO2, carbon dioxide, that doesn't actually help the whole scenario.
That's right.
So that would be another reason to go down the path of low carb, high fat diet.
Yeah, that's right. So in people, especially in people with severe lung disease, it can put additional pressure on their ventilatory system. Yeah.
So moving on, how would you feel? What's your take on sleep and chronic lung disease, or just respiratory function itself?
Well, I think that I sort of think of like general health with 4 pillars of health, and I think sleep is one of them, and it's probably the one that sometimes is forgotten about. The other one is exercise, nutrition, and mental health, and they all play together. And I think that if people have an issue with their mental health, then it's going to be difficult to correct that and improve your mental health if you don't have good quality sleep. Because everybody knows if you just sleep poorly or have a few nights of bad night's sleep, it always affects how you're feeling yourself. The same as exercise. If you have good quality sleep, you're much more likely to be able to get exercise because you feel a bit better in yourself, you have a bit more energy, you're more likely to get out there and be able to exercise. And then obviously we've spoken about nutrition playing a role in that as well. So I think sleep is really, really important and under-recognised. And I think sometimes if someone's got a problem with their sleep, it's probably the best place to start. Because if we can correct their sleep, so if there's an underlying sleep disorder like sleep apnea, treating that to improve their quality of sleep or ensuring that they're getting adequate amount of sleep, then we get the benefit of that throughout the day in terms of how the person feels. And then it's much easier to make those other changes. So, try and get more exercise, try and eat the right things. When people have poor quality sleep, they're much more likely to eat carbohydrate because it gives you quick energy. So if you're going to try and get someone to stop eating carbohydrate, you're better off to improve their quality of sleep first, and then it's easier to make those changes. Same as, smoking cessation and things like that. So I think starting with sleep is really, really important.
Yeah, I have a toddler. When I've been woken up many times overnight, the next morning my diet's pretty worrying. And it's just because you're just craving the bad things. It's just natural. But yeah, so sleep apnea is one of those things, isn't it? And also, if you've got untreated anxiety, as you alluded to, like you get your middle insomnia, you wake up in the middle of the night, anxious, worrying about things. That's going to disrupt your sleep. Many episodes ago, Fergal and I and one of my other colleagues, we discussed what happens during sleep and how our brain repairs itself, how areas like our amygdala and things repair itself and things regenerate, and you're getting rid of all the bad stuff and sort of regenerating and repairing processes. If that has to happen once you've had at least 3-4 hours of sleep. If you're having interrupted sleep, that's not going to happen. And that's what you're also pointing out too. That's why we exercise better, because we have more energy during the day. And the other thing that happens is hormone changes too, because all that is happening, and that will disrupt our hormone balances, if we don't get good sleep. And that would result in us also sort of stacking on weight and conserving more energy because our body's just not had that rest. Because we know it's actually not actual true rest when you're sleeping. It's our repairing process. But
yeah, that's right.
Sleep is so important, isn't it?
Yeah. Well, I mean, sleep deprivation increases mortality. So that's
exactly
increases the risk of heart disease, increases the risk of lots of things.
Yeah, I remember there was a study with healthcare workers, wasn't there, some years ago about shift work and not getting that night sleep and things, and how it was associated with the risk of heart disease and things like that.
Yeah, absolutely. Yep. No, I think shift work is not very good for people actually because of that continually changing their body clock. And circadian rhythm and body clock is probably another under-recognised problem with sleep, where some people have difficulty sleeping, and it might be because their body clock is not aligned. And so the typical situation, say, is a teenager who's up late at night, playing video games and things, and then sleeps in all through the day. They've got like this. There's not a problem with their sleep; it's a problem with their body clock that's shifted forwards, and sometimes that can also affect people's quality of sleep.
Yeah. So we've covered most of the factors already. The only thing left is really smoking, drugs, alcohol. just in a nutshell, just because we're running out of time, what's the one thing you would say? I mean, I think everyone knows how it affects our lung function and things, but what's your quick pearls of wisdom around those things?
Yeah, I mean, obviously, the single most important thing that a person who currently smokes can do is to try and stop smoking. I think from a doctor's point of view, it's also important to recognise how difficult that is and how addictive it is and how difficult it is for patients. And sometimes people feel really self-conscious about the fact that they smoke. And so making people feel bad about it or telling them they might die or they're going to, I don't think is helpful, but trying to really understand why people do it and to try and really support them to try and quit is really helpful. And sometimes if people have quit before, I'll tell them that you're in much higher, much more likely to be able to quit again if you have had successful quit attempts in the past and gone back to cigarettes. If they've quit before, then, it's useful to find out, well, what happened last time that allowed you to stop? Did you use nicotine patches or did you use some medication or hypnosis or something? Because if something's worked for someone before, it might well work for them again, so it's worthwhile trying again. So I think anything that we can do to try and help and support people to try and quit smoking is, obviously far and away the most important thing we can do from an overall health point of view.
I think you mentioned a very good point, about being aware as practitioners that we should not be too rash and too quick to judge. I think a non-judgmental approach is so important, and being slow with it, and the fact that it's fine to take your time to think about it as long as you know what the risks are. But take your time and get there, and then if you fail, it's okay, because there's no such thing as a failure, because that's part of your stages of change, really. And in fact, just in the last week, I've had 2 patients who've come back to me saying, right, you spoke to me about that. I think I'm ready. And it's amazing because, it's not actually forcing it on. It's just the fact that you have the conversation. And I think it's important to keep having those conversations.
Yeah. I don't think anybody smokes and doesn't know that it's bad for them. So I don't think telling them it's bad for them is going to help. And I don't think anyone quits smoking because they're told that they're going to die. I actually don't think that that's motivating for people, but I think that supporting them and planting the seed and allowing them to come back, that's really successful. That's great. Nice story.
Yeah, no, I think one of the most motivating factor I find is finances.
Yeah.
Gosh, so expensive. All right. So, well, thank you so much for joining us, Barton. It was lovely talking to you today. Any last minute things that you'd like to just sort of highlight, or are we...
Thank you for having me. No, I think that's a nice overall sort of summary of what I think to do. Yeah.
Excellent. Thanks so much for joining us.
No worries. Thank you.
That's all for today's episode of Lifestyle Matters. Thanks for joining us. See you next time.